Alldus podcast is brought to you by Alldus International, supplying your expert AI and digital transformation staffing needs across the US and Europe. Today, you are listening to our AI in Action series, where leading minds in AI from across the world share their story, success, and advice. AI in Action cuts through the hype and explores the true impact of artificial intelligence in our world today.
You're listening to AI in Action. I'm your host, JP Valentine. Our guest today is Thor Clark. Thor is the CTO at Well Health. Thor, welcome to the show.
Great to chat with you today. Appreciate the time.
Of course, it's our pleasure. So Thor, let's start with yourself. Could you give us a brief overview of your journey in technology, from where you started to some of the roles you've held along the way, taking us up to where you are?
I have been a technologist really my entire career, both in terms of inclination and in terms of training. I started off in computer science, really focused on machine learning, and then also cognitive science, focused on neuroanatomy and the structures of the brain. And so it's a very interesting place to start a career in technology. And I was someone who was programming at an early age and really enjoyed computers and working with computers even before high school. So that's been a big part of my life. As I left school, I really had the great fortune, really, to be involved with some great companies early on. And so I was a software engineer for a number of years, joining a very small company as the sixth employee. And we grew that company over the course of a few years and ultimately sold it, which was sort of a $50 million sale and great return for our investors. And the acquiring company ultimately, over the course of the next few years, brought me in as the CTO, and that was the beginning of my management career in technology. And we ultimately took that company public on NASDAQ, and it was acquired by TD Ameritrade. And so that was in the financial services space. And that was another kind of my first exposure to big data. At the time, we were collecting all of the really data feeds from all of the stock exchanges in the US, including bid and ask and ticks, and really a tremendous amount of data there, and doing a lot of analysis on top of it. That was part of the product and the service that we offered. So that was really a great experience. As a result of that, I was able to take a little time off, and I went back. I did a graduate degree, an MBA, to really get a little more exposure to the capital side of the business and the finance side of the business. Spent a little time in private equity during my time getting that master's degree. And then after that, went and got some big company experience at Yahoo, really a little bit more on the sales side of the organization. So that was a great exposure to that component of the world. And obviously with Yahoo, a tremendous amount of data exposure in that business. I started my own business. So I ran my own business for a couple of years. I would say I've done 4 startups, and 3 of them have been successful, and the one that wasn't was the one that I started. So,
listen, that's a pretty good ratio. Yeah, I wouldn't read too much in. You've had more success in the startup space than not. So, I think knowing the external likelihood of startup success, you would take those odds any day.
Yeah, I've been very grateful to have had all those great experiences. So I did that for a couple of years, and it was a very interesting experience, and I think ultimately it's given me a tremendous amount of respect for what it takes to really start a business from nothing and grow it and be successful with it. And then I transitioned into the transaction management, electronic transaction management, and document management space, and was a technical co-founder of a company that offered e-notary and e-signature solutions. I actually did some pretty interesting data work there as well around both document categorization, and we actually did quite a bit of work on document analysis. So the goal there was to take the activity that a paralegal might be involved in terms of doing a first pass at a contract, identifying potential worrisome clauses or components of the contract that might be unusual and surfacing those. So that was a very interesting project. And we actually looked at a lot of work that was happening at Stanford and other areas in the legal space and the document assessment space. And that turned out to be a very challenging exercise, as I'm sure you can imagine. And I think in the years since, there have actually been some organizations that have made some good progress with it. But for us, that was a truly kind of an R&D experience where we really succeeded in that business, was just workflow and efficiency gains. And that business was acquired after a few years. It's about a 5x return for our investors, including Khosla Ventures and some others. So another solid outcome. And then I spent some time in security. The company that acquired us was in security and was a VP of engineering there for a number of years. And then I entered healthcare. And so I've been in healthcare now for about 5 years. Really, the through line for my career has been business to business, enterprise SaaS solutions, servicing highly regulated environments. So in document management, financial services, ad tech, and now healthcare. So that span of kind of experience across a number of industries, but always in that enterprise SaaS and highly regulated environment, has been very helpful for me. I think particularly entering a new industry for me, relatively new. I've been in healthcare for about 5 years now, and really bringing a lot of the best practices of the enterprise SaaS world to the healthcare IT space has been tremendously beneficial. I think as we've grown our business and really found ways to serve healthcare organizations successfully.
Which is a great segue then into explaining your current company, Well Health. So if you can take us through the 10,000 foot view of who Well Health are as a business, what the product is, what you're trying to do, and then we can jump a little bit into the data science and the engineering behind all of that that's making it.
So Well Health is a U.S. company. We provide services to U.S. healthcare organizations, but primarily providers. So provider being an organization that provides direct service to patients, with doctors, nurses, hospitals, ambulatory meaning outpatient activity, various types of office visits, and so on. We tend to serve enterprise organizations, so large healthcare organizations where they might have 5,000 or 10,000 doctors, organizations that might have 7 or 8 hospitals in a particular geography, maybe 1,000 locations, right, across maybe even a couple of states. These organizations are servicing millions of patients every year, millions of visits. And one of the challenges they face is patient communication. And that is really everything from, as a patient, I might have a question about my medication. I might have a question about my next visit. As a healthcare organization, I might want to know if the patient is planning to show up for their next appointment or if they need to reschedule. The healthcare organization, I might want to reach out to a patient after they've had a procedure and solicit information about, for example, their pain levels or whether they received the material that was meant to help them in their recovery. If there was medication or prescriptions that they had, ensuring that they had received that actual medication, and then taking action on those patient responses. So that's really both kind of a financial kind of component to that in terms of ensuring that if there's a doctor who's expecting to see a patient, it's helpful for them to know if the patient's going to show up or not, and maybe do an outreach and reschedule if the patient's not able to make it. And then also truly clinical outcomes, which is really about helping patients recover quickly and identifying those patients who've had a procedure and are recovering well, and then those ones who are not recovering well, and ensuring there's a kind of an early intervention to support those patients. And part of that practically is when you've got millions of patients, it's very hard to staff, say, a call and just do outbound calls and hope, right, that you're going to be able to reach the right patient at the right time, and they're going to pick up the phone and then give you the information. And that's a very labor-intensive activity. And also without necessarily great outcomes. We'll see sometimes in those types of activities, 5% response rates where you just have a call center team who are dialing and calling out to patients. And so we offer a full solution to that for a large healthcare system, a patient communication and automate solution.
So Thor, you've given us a great overview of the company, the mission, and how it's able to help doctors reach their patients, particularly with the impact of COVID. Never has it been more important for doctors to be able to reach their patients remotely and communicate with all the challenges that the pandemic presented. I want to now switch direction and have you give us some insight into the data science and the automation behind the scenes that allows Well's platform to work so successfully. So can you give us some insight into the layout of the team, the type of work done, and some of the projects that your teams are involved in on a daily basis?
So as we think about these large enterprise organizations who are routing all of their patient communication activity through, and then also using Well to automate much of the patient journey. And when I say automate the patient journey, I'm thinking of that post-discharge workflow that I described, or an automation reminder workflow, or a variety of other types of workflows. For example, someone who is maybe overdue for a particular type of screening that is recommended for someone of their age, and really using Well to create that patient journey and then automate that patient journey, which involves both interactive communication with the patient that's managed by the Well automated system, and then also that ability to escalate to staffers who can jump into the conversation when needed and ensure the patient is really getting their issue, resolved, or getting the care that they need in a timely fashion. As we think about that broad scope of activities that was engaged in on behalf of a large healthcare system, as you can imagine, there's a tremendous amount of data available in the system specific to that healthcare system, and as Well provides services to that healthcare system, parts of those services are providing insight based on that data, which involves both the communication between the healthcare system and the patient, and then also on behalf of the healthcare system with the automated interactions with the patient. And then additionally, the data that's getting from the healthcare system. All of those things together provide a very interesting longitudinal view of patient activity and patient interaction. And one of the services we provide our individual healthcare systems, if they choose to take advantage of that capability, is really, well, a variety of kind of items. One is just insights into that data. And that's everything from, say, a dashboard that we might provide to just look at counts and trends of some very kind of simple metrics, to analytics, where a healthcare system might want to look into their data and look at relationships between various types of information and activities in the system and help assess what's an effective outreach, what's a less effective outreach. For example, how might we change the text if I'm a healthcare system? How might I go into change some of the language or further customize some of the language to solicit a better interaction with the patient, and using the robust Well capabilities to run that analysis and really inspect the set of data in the system and use that to identify things that we could test. And then, of course, there's, as we test, also using that data and the tools to ensure that people are able to make good decisions, have those actionable insights coming out of the data set. And then finally, I think the more predictive components are very interesting, where a healthcare system might be interested in taking a particular patient and assessing, well, what's the likelihood that this patient's going to show up for their next appointment based on past behaviors or based on other similar patients in that healthcare system, and what those kind of behaviors have been in the past. So I think there's some very interesting opportunities there some of which we have built and some of which we're in progress to build, around really helping a healthcare system look at their patient population and the behaviors of that patient population and really assess effectively, right? Using data in really sophisticated ways to ensure they're taking the right actions with each patient to really drive the best outcomes from a clinical perspective. What's the best way to engage with a particular patient to ensure that they're the highest likelihood of refilling a prescription or getting a screen that's required, or for patients with chronic conditions, really helping those patients schedule the follow-up and the work that's going to help them have the best quality of life and the best outcome. So that's where I think we have such a fascinating opportunity here at Well, because really we're oriented around patient outcomes and patient service on behalf of the healthcare system. And a part of that is using data to help make the right decisions about patient outreach and communication and so on, with the end goal of really improving outcomes for every individual and patient we engage with on behalf of the healthcare system. And the interesting thing for us is patients really never know Well exists. For them, they're just communicating with their doctor. And so I think that's been a kind of a huge benefit, because from a patient's perspective, we're really just providing or working to provide the best possible experience where they don't have to worry about, oh, there's another player involved or anything else. It's just, oh, yeah, here's my doctor. I'm communicating with them. I'm engaging with them. They're giving me guidance. They're answering my questions, and Well facilitates all of that in a way that is both efficient and effective. And a lot of that is driven by data.
You are listening to the Alldus Podcast. When you're looking to scale your team, or if you are interested in showcasing your company in a future episode, reach out today. Or if you're in the market for a new role, visit our website to view open positions, www.alldus.com.
You mentioned the opportunity for the people working at Well to have an impact and what it's like to be part of the team. Can you give us some insight then into what the growth has been like as your time there as CTO, and more importantly, looking ahead? Obviously, the impact of COVID has accelerated the need for products health, anything that's digital health and can improve patient impact. Can you give us some insight then into the current setup of the data team, the mix of data engineers, machine learning, data scientists, and then as you guys continue to grow, what opportunities are there going to be for people in this field who have an interest in?
Yeah, great question. So we've grown quickly. I think we were about 25 people when I joined. We're about 200 plus today in the course of just a little bit more than 3 years. We have raised, we're a Series C startup, really driven by strong sales growth and product quality. So we're ranked best in KLAS. So KLAS is the healthcare equivalent of a Gartner or Ford, and they've identified Well based on third-party research, customer interviews, and so on as the best in class in our category. So this is another indication of kind of product quality that we've been able to deliver. And I think for someone thinking of coming to Well, really the opportunity is to be a part of an organization that's a market leader and that is entirely oriented around improving the patient experience of getting effective healthcare, and then also supporting the care providers, right, doctors and nurses and so on, and also improving their quality of life through better patient communication, engagement. I would say we were growing quickly before COVID, and it was certainly a situation in which we had a product that was tremendously helpful for healthcare organizations as they needed to do broad communication to patients around vaccines and COVID safety and so on. So we were able to really use our existing product to create virtual waiting rooms. So that's an example where someone might need to go to the doctor's office, but can stay in their car and just communicate via text or secure web messaging with the office staff using Well transparently, so that they don't have to sit in the waiting room. They can wait in their car, and then when a room is ready, they can go right to the room. So we were able to create that capability within just through configuration, which was a real benefit to healthcare systems. And then as we've navigated through the vaccination process, really just helping patients schedule those vaccination visits. We have a white paper on this, actually. I think Well has been a part of about 5% of the vaccination appointments in the US. So we've really had a significant impact there in terms of helping patients schedule a vaccination appointment and get that vaccine. And that's just a function of the scope of our customer base, because we really work with these large enterprise customers with millions of patients in their systems. We've been able to really do a lot to have a real impact in that area.
So Thor, as you've given some insight into the developing use cases that came from COVID, and you look at, there's so much more you can do in terms of growth of the platform, but new additions. When you look ahead and you think about the next year to 2 years, where do you expect the team to grow from, particularly your data science and engineering team, from where it is currently to how many more people you're going to need to add in, and overall the objective?
So from an overall organization growth perspective, we've been growing, I'd say, more than 100% every year. So more than doubling every year for the past 3 years. I would expect that to continue. We're definitely on track to accomplish that. So when we look at next year, you say 300 to 400 people, and with all the additional kind of structure and opportunity that comes with that, I would say, thinking of the data team in particular, we'll continue to make informed decisions about third-party tools that we can use off the shelf that provide some of the data science and the data models that are really going to help us continue to improve our systems. And then also continue to think about where we're going to do R&D. And I think one of those areas is very much around working with those individual healthcare systems and helping them look at their data and really capture insights. The predictive analytics is a huge portion of that, helping test and really improve the type of engagement and the timing of the engagement and the content of the engagement in both directions that these healthcare systems are working through. And then I think ultimately, as we look, further afield and really continue our work to expand into supporting clinical outcomes, I think there's just a tremendous and fascinating opportunity to support our healthcare system customers in looking at their data and getting a better sense of clinical outcomes and tying that patient engagement activity to clinical outcomes and really optimizing that very directly. So when I think of that, I think there's truly for anyone that is interested in healthcare and particularly clinical outcomes, meaning really just a better health outcome for an individual patient, that I think is a huge and fascinating opportunity here.
Amazing. Final question from me, Thor. As you've been able to consistently grow your team while working on these multifaceted projects, you've had to compete in a super competitive market for talent. When you're speaking to candidates, who many of the good ones will have multiple opportunities to consider, what is it that you say to data scientists or data engineers that has made them so interested in joining Well as opposed to some of the other really compelling opportunities out there?
Yeah. I do think it's true. People just have options. I think Well tends to appeal to a person who is interested in the industry that we're in and the mission that and so we tend to engage with a person that is interested in healthcare in one way or another and interested in the data opportunities within healthcare. And then I think beyond that, it's really, it's one, the fact that as we provide these services to these large healthcare systems, they have, I would say, very sophisticated asks and interests in this area. And so for someone that is a data scientist or is interested in that field, the opportunity to work with really some of the largest healthcare systems in the world and engage with them, very deeply, and, with the purpose of helping them improve patient outcomes, I think is really compelling for someone that is interested in the space and in our mission. And then I think beyond that, of course, it's people and culture. And obviously not every company is a fit for everyone. I think in our experience, as people have gone through the recruiting process and gotten to know the team and the level of energy and the kind of commitment that the team has and the kind of collaborative spirit of the organization, I think that has also been something that's been really compelling for candidates. And just really getting to know, not so much listening to me and what I say about the organization, but actually talking to a number of people in the organization and getting everyone's individual assessment, I think generally tends to be a very positive experience for candidates.
It does, because I've spoken to several people who are working with you and they really talk about the impact, the culture and the mission. So it's certainly resonating at all levels. Thor, listen, thank you so much for coming on and talking to us today. It's fascinating to learn about what you and the team are doing at Well, and we know it's a product that's desperately needed. So we wish you and everyone on the team continued success in growing this product nationwide.
Thank you. This has been really enjoyable. I appreciate the time. I love to talk about Well and what we're looking to accomplish in the world. So I really appreciate the time and the opportunity.
Thanks for listening to this episode of the Alldus Podcast. If you enjoyed today's episode, don't forget to subscribe, rate, and review. We are available on Apple Podcasts, Spotify, and any Android podcast of choice. You can also head over to our website, www.alldus.com, to listen to more podcasts, view our open roles, and stay up to date with industry news. Thanks for listening, and stay tuned for more great episodes coming very soon.